about the passion totally of all the caregivers here, of what they put into to making sure that the patient is getting the best care possible without interruption of health care. The polypharmacy and having to deal with the elderly, and I'm getting up there, and about the amount of medication that drug interactions or what it can cause to people. For every day that you are in bed as an elderly person, you lose 5% of your muscle function. And, you know, a lot of them are in bed for more than that time. And sometimes the too much medication can actually cause permanent damage. I was really intrigued with the youth in transition and hadn't realized that there was that much difficulty. I never thought about it before, of young children and then going into adulthood and trying to find you know, a doctor and to carry on. And when we talked to the youth in there, they had some really serious issues that they had to deal with as adolescents. And you know, and I asked the question, are they journaling their journey through all of this? Because I think that's important as they grow into adulthood, that they've got some reflections of when they were younger, and it could have an impact on the future. I'm just trying to think, in respirology, what has been done there in order to eliminate hospital visits, the forms that are being put out in order to expedite matters, to make shorter time for specialists to have to write out things, and these forms would follow the patients right to their own doctor, and they're not finished with the forms yet. They're still in transition. They're still working on them to try to make sure they've got exactly what they want. It has been an absolute fantastic experience for me, you know, to be a part of this. I've gone to conferences before, and this was one of the best. A lot of BC should be proud of the steps that they have made.